I want to welcome everyone to the second of our art events for the academic year. This is our program, as you know, that aligns the work of artist patients with our school's core curriculum in order to foster enhanced understanding between patients and future health professionals. So that's our HEALS mission for the art gallery and for this work. And I'm, as usual, very grateful to Ted Meyer, who is our artist in residence. I'm going to let him introduce our artist, but I also wanted to welcome and introduce Dr. Deborah Waters-Roman, who is a clinical associate professor at USC School of Social Work. Her teaching includes working with students in the Public Child Welfare Stipend Program, and she has also worked for the Los Angeles County Department of Children and Family Services for over 30 years. As a licensed clinical social worker and licensed clinical psychologist, she provides mental health services to trauma survivors of all ages and also works with special needs children and their families. So I'm going to turn the program over to Ted, who will introduce our artist.
Hi, everybody. And Marie Perreault is our artist, and she's going to tell you how she landed up here, about her work that's all down in the gallery. If you didn't get a chance to go to the gallery ahead of time, please go down there afterward. I want to start with some facts about caregiving. So a lot of you guys are not only going to be dealing with your patients, but a good proportion of the population at one point, including you, are probably going to be caregivers. So I'm not going to go over all these, but look at them and just remember that as you're dealing with your patients, you're going to be dealing with their caregivers, and that sets up a whole dynamic for you guys, and a lot of Alice's artwork deals with that. And normally, if I'm doing a talk, I don't bring myself into it, but this is me. This is me when I was a little kid with my mom. And what I learned being a sick child is that my illness affected everybody in the family. It affected what my mom did, it affected the dynamics with my brother, it affected the economics of the family, all the interpersonal relationships. Everything that was focused on me affected everybody else. And that's sort of why you guys are here and what I want to talk about. I don't want to talk just about the artwork, but I want you guys, while you're talking about the art, to talk to these guys about how they might have a perfect course treatment set up in their head as they're working with their patients, but it might land up that the realities of the life, you have another child, you have other relationships, that you can't do absolutely everything that a doctor thinks is best, because there's just so much else going on in life. My mom landed up going to the hospital and making a living as an Avon salesman because she sold Avon to all the nurses in the hospital. You know, so you just never know what's going to happen because of one person's illness. So with that in mind, let's talk about the title and chain reaction, how one thing leads to another. And let's look at your son and tell us what happened with your son. And I'll leave it to you to take it from here.
Okay. That's my guy, Julius. And riding on the back of his chair is my daughter. She's 4 years old. So chain reaction has a double meaning. Number one, it's a neurological episode that happens in the brain when there's a brain injury. And my son has hypoxic ischemic encephalopathy from birth asphyxiation. So the cascading event that happens neurologically in the brain causes permanent injury. In life, we have a cascading event that occurs through our lifetime, and one thing affects the other in all the decisions that we make, in the places that we go, based on that particular event.
So you, as a social worker, somebody comes to you and they are expecting a healthy baby. They're expecting, everything that they've seen in the magazines, and this happens. So how do you bring them into the system? How do you get them prepared for the life they've got ahead?
Thank you. So one of the things that I do is I run groups at the Los Angeles County Regional Center. I don't know if you have heard of the Regional Center, that they provide an array of services to children and adults with different types of developmental disabilities. And what I do is work with parents after they've received a diagnosis. And I really consider it in many ways like a grief group, right? Because these parents oftentimes envisioned what their child's life was going to look like, right? Their child was maybe going to be the next president of the United States or something like that, right? An amazing athlete. And then they get the diagnosis and they realize that maybe what they had imagined for their child isn't going to be their reality. And there's actually a grieving process that I think many parents go through. And so I try to help facilitate them, and also in the social work program, try to help students understand, again, as my colleagues mentioned, how this really impacts the entire family system.
All right, so we're going to look at your work.
Okay.
And this is pretty free form, so feel free to jump in if anything in her work reminds you of things you're dealing with. So why don't you tell us about this series? Everything is downstairs. You can go see it after the talk.
This is a medical tool. It's called Buddy. And what happens to Buddy will happen to the child. So I see Buddy as a modern-day voodoo doll. Each time that he went into the hospital, Buddy came with us. We were given Buddy for his initial, well, he was there since he was born. But the first time they had to intervene surgically, Buddy came. And then ever since then, all of the procedures that he was going to get, my son, would happen to Buddy first and then to my son. So Buddy becomes a surrogate, so to speak. And when the child is taken away from the parent and brought into the OR, Buddy is passed to the parent. And then the parent has Buddy instead of the child. So there's a lot of connection with Buddy. Years later, in grad school, I brought Buddy back out and I started doing drawings of Buddy. And I thought about, oh, and Buddy's face, Buddy's blank, by the way. You get a blank Buddy. They were originally made by volunteers, so many different colors skin, but blank. And then the child would draw on the doll. In this case, my son's quadriplegic, so I would sit by the bedside and I embroidered his portrait onto the face of the doll. So years later, I brought Buddy back out in grad school and I started doing all these drawings. Well, what if Buddy were Batman? What if Buddy, what if I could wrap up Buddy and change what he meant? And I just started playing around with Buddy. There are many, many more drawings than what you see in the gallery.
So she found you. Well, let me go back. You were doing landscapes and things beforehand.
Before that, I've always been a figure artist, working with a human figure.
Figure, sorry.
No, that's okay. Landscape too. I mean, the body is a landscape, so that's okay. But my so-called expertise was the human figure, and I taught a lot, and so I learned a very specific way of how the body functions, how the body balances, how the body breathes, and I did all this through visual art. And so I was working, right before this happened with my son, I already had a commitment for a show. And I was working on a collection of pieces that were from my imagination, that were a combination of fiction and narrative, extrapolated from my own life. And they were just relational characters. When my son was born and this happened, I couldn't show that work because I couldn't relate to it anymore, because now I had been derailed and I was in another place trying to figure out and understand what happened to my baby. And I needed to know internally what happened to him. And I tried talking to other parents, and I was very surprised that they couldn't tell me either. Parents who were in similar situations, they couldn't tell me medically what happened. And so I needed to know that. So I had to take a lot of time to sit down and read neurology of the newborn. I couldn't understand one page. I didn't understand the language. I was incredibly intimidated. I was an artist. This was the brain. So I had to get a medical dictionary. I had to go to the medical library. We didn't have the internet like we have now. And so I had to educate myself. So now I was in the throes of this. How could I show that other work? How could I talk about it? It didn't matter to me. The body didn't work the way that I thought it did. Communication and relationships weren't the same that I thought they were. So all that work became obsolete. So I started a whole new set of work.
So she had art to sort of let the pressure off a little bit and for self-discovery. So when you have other people who come to you that aren't artistic, maybe other than group therapy, what can you give them to help them sort of self-discover through something like this?
I think it is really a process of self-discovery. So I also have a son who's on the autism spectrum myself. And my son wants nothing to do with art at all because he doesn't like anything abstract. He's a very logical type thinker. And so I think it is trying to really get to know the individual and find out what their strengths and interests are. So for example, my son is very interested in US history, right? So he spends a lot of time studying US history. He actually found an error in a textbook in terms of the years that George Washington was president. And he wrote the editor of the book, and it was a mistake. And so that was an exciting experience for him. But I think with my patients is just trying to encourage them to find some outlet for that self-expression and really come to understand and accept their own diagnosis in a way that's meaningful for them.
All right, so tell us about this series. When in his development did this happen, and what's going on in your head?
There are many more drawings than these, but I selected the ones that I thought would be most applicable to what we're talking about today. And they're all on paper. They're all with Prismacolor, which is a color pencil, with some acrylic paint on them. I, prior to this, was doing all oil painting. And the first noticeable change is that I couldn't do oil painting because I had to be available to care for my son. So I had to be able to put the tools down in a heartbeat, go take care of him, settle him down, then I could come back and work. So I had to go to a dry medium. So that's why I switched back to something that I could stop and not have to worry about the drying time and all that other stuff. Again, these were all done in the year 2000, the year that he was born. And as I'm reading these medical journals and I'm understanding this avalanche, this chain reaction that's occurring right there in front of me that I can't see, I'm getting more and more devastated because I thought it was over. I thought the initial injury, once it was done, it was over. But it goes on for months and months, the damage that occurs in the brain. So this was my way of understanding things like neurological agitation. What does that mean? Tube feeding, how do I do that? One of the doctors made a terrible mistake and put a feeding tube. He had one in his nose, he had an NG, and they changed it to a regular G tube. And when they did that, they actually made a mistake and put it into his peritoneum. So we fed him, and he nearly died that night. So he had to be opened up, and they had to take out all his intestines and everything and clean him out with saline and put him back together. So that's what that drawing's about. It was me getting the grip of everything that I had to deal with. I had to have a vision of everything that we were going to face and that we were facing right then.
So I'm thinking of, you did bodyscapes before, but nothing, I don't want to say nothing impactful. But I mean, this is a whole different level of looking inside yourself to put it out there. So what was the reaction of some of your clients maybe who had seen your other artwork and saw this sort of work? And then while she's answering that, just so I don't forget the question, this learning process, I had a friend who had cancer who talked about having to go to cancer college because she had to learn a lot before she got treated. So I'm going to let you answer first, and then you can talk about the process that their patients, families, and things are the learning process of that.
Okay, so during the exhibit, my son was there. It was way at the end of the year. He was born in February, so I was able to actually take him out in February, at the end of the year. So the first thing people noticed who had been following my work was the color. That was the first thing they said. They said, your palette changed. And it had. It changed for one. Of course, I had to change from oil to the. But when I remember sitting with him in the hospital, and the lights on the table, because they're not really in cribs. I don't know what you call those little bed-like things that they put them in, and they glow. The babies glow. I mean, it's just so incredible. And I remember being there and just thinking about the color. And so, of course, when I went back home and I'm working on drawings later, after he was home, it just was inevitable that the color would change.
So the learning process for your clients going through something like this. I know in mine, I'm going to get back to my mom, who was my caregiver. She became a real expert at a time when there were only about 200 people with my illness, but she knew all about it. So when you talk about your people getting up to speed as caregivers.
Absolutely. Yeah, and it's definitely a challenging issue because there are so many different systems that you need to interact with, so many different professionals that come and go, and trying to figure out what is their role in this entire picture. And then also the community I serve. I serve basically communities of color. I'm Spanish speaking, so I work with a lot of families where English is not their primary language. And so they often face additional challenges because they sometimes don't understand what doctors or nurses are trying to tell them. Sometimes they're undocumented, right? And they're fearful of, what is this going to mean if I get services? Can I get services, or are there going to be negative consequences for me doing so? So I think with a lot of the patients I work with, it's really a process of educating them. And I also work a lot with advocates. So I have a lot of advocates that I can call on that will go to different meetings with patients that I work with to really make sure that they're understanding the process and that their child, or sometimes it's their adult child now, is getting the services that they need. But it's very overwhelming, and I think it's important to understand that oftentimes when we're telling parents, you need to do this, you need to do that, again, they have a context of trying to operate within their own family. They may have jobs. Siblings are impacted, right, when something like this occurs within a family. So really being sensitive to that we may say something that seems like a pretty easy directive to follow up on or something to do, but it could be much more complicated for the family to do that than we're imagining.
So before I switch the slide, so the image of your son opened up. Mm-hmm. I mean, this is totally, as an artist who deals with galleries, how many times do people go, no one's going to buy that?
I still get that. Yeah, I still get that.
All right, so let's talk about this,
So this was for another exhibit. The exhibit was called Gifts. And I questioned the gifts that come to us through tragedy. Are the gifts that come to us through tragedy worth that tragedy? Are they good enough? I'm a completely different person than I was before my son was born. I'm far more articulate. I'm much less shy. And I don't believe any of us are on different levels. I really believe we all have our purpose, and we don't have to be intimidated by somebody that we think is better than us or higher than us. This happens a lot in hospital situations, especially with surgeons and nurses. And so it's changed me so much. And that exhibit was really just posing that question. I used the images that were from his actual brain scans. There were brain scans taken just a day after birth, and then brain scans taken 6 months later. And I can look at those paintings and I can tell you that the one on the top left was his newborn brain, and the top right was his brain shrunk, because the scar tissue that was left over, and you have the absorption of the dead, the necrosis that happens in the brain, and then those cells absorb back into the body. So that's why the other one shows the space between there. So when I look at these things, I see a time thing happening. The one on the lower left is called When You Left. And what that had to deal with was, like, I realized that I wasn't going to get to know the baby that I knew that I carried around, the baby that kicked me inside, all of those kinds of things. That person was now gone, and that I was going to have to get to know this new person. And by the way, no, the gifts are not worth it.
Looking at it, any thoughts?
Yeah, something that I just thought about that we do a lot with our social work students is, I don't know if you guys are familiar with something called ambiguous loss theory, right? And it's something that I utilize a lot with my patients, where it talks about, like, lots of times in our society, if someone dies physically, right, we kind of know what to say to them, right? We maybe send them flowers or give them a sympathy card, or, oh, I'm so sorry for your loss, right? But what do you say to a parent or an individual when they tell you, oh, I just found out my child was diagnosed with something, right, that's going to alter the course of their life? And lots of times, friends and family members don't know what to say, because it's, it's not a typical kind of a situation. And so, again, with our social work students, it's really important that they have an understanding of what these families are going through and how best they can be supportive of them and make the families feel comfortable, right, to be able to share whatever they want to about their experiences, that there shouldn't be anything that's taboo or that they can't talk about.
All right, what's going on here?
Okay, back to the landscape. So the word landscape in our history goes way back, in oil painting. And it's a genre that's very specific and has been explored in so many different ways throughout the history of art. But today we use the word landscape far more than it's ever been used in history. And we use it to describe so many things. We use it to describe the landscape of social platforms, the landscape, the political landscape, right? The economic landscape, the body landscape. So it's really just so overused. Here I've taken the body landscape and overlapped it with the landscape, the oil painting landscape. Those are his tubes that have been used to feed his body, to nourish him. 2 different types of tubes. And I combined that with the landscape, but the landscape's not real either, right? The landscape is just my illusion of paint on a surface that I just gave to you. And so what is real? Is it the fact that we have these augmented plastic parts that can help a person sustain life and have a better life? We always judge health by how much we've intervened, right? And so when we really look at the world around us, especially landscapes today, mostly they're man-made, right? Human-made, excuse me. And so I just feel very much like that combination between, what is natural and what is not natural. And is it okay if those things, work together?
One of the things, so a lot of the artists we've shown here, they use the medical supplies in their work. And there's something, you get so familiar with them. They're, like, I think most people would look at them and go, oh, that tube's been in your son, it's been feeding him. But for us who have to deal with a lot of these things, they're so life-giving. We have sort of a different view of them. So why don't you talk about starting to incorporate all these things that give your son life into the artwork?
Well, when you're an artist, it's not like going to a job and coming home and it turns off. You just are. Everything that you see and look at, the relationships you have, you're not even thinking about art, and you always are. You're always noticing the relationships between things. And so while I'm working on my son with my hands, I'm not doing anything differently than what I'm doing in my art studio. It's the exact same. And I'm picking up these tools. There's the sensory input that I'm getting through these tools, the visual input. And you struggle, too, with the tools a lot, just like in the studio. So they're amazing things. Artists, designers design these things. Like these tubes, we just got new ones that glow in the dark. Like, you don't have to even disturb that person. You can go in there at night and you can see the little purple glow and give them their medication without disturbing them. Like, who thought of that? I think it was a mom. It's just so awesome. So I was looking at all these materials that are just getting tossed away, and I'm thinking, these are so fantastic. Why am I drawing them? Why aren't I just using them? I find them so remarkably beautiful.
What's going on?
Okay, this is body-brain connection, and this is that's not the title. It's actually a polytip. I called it a hextatip, and what that is it's just multi-paneled oil painting that has been used through the history of art and religion to educate. And so I decided to make a contemporary one. And I did the brain-body connection. And the body, the chair, is the stand-in for the body. Because chairs are like bodies, right? They have legs and backs and seats and arms. And so they're very, very physical, And I burned the chair and so by burning the chair, I'm burning the body, right? But specifically the idea of the body. The idea that I had of the body prior to what I have today is very different. And so and then of course, those wonderful little brains.
All right, one more with your art supplies.
Okay, so this is called Yellow Sweater. And in the year 2000, everyone across the board, every scientist I talked to, every doctor said, in 10 years, your son will be cured. In 10 years, your son will be cured. And I held on to that like you would not believe, because we were moving so fast forward with stem cell research. And I just learned so much about it. I followed researchers from New York to California, leading researchers in that field, and it was going to happen. Low-hanging fruit. Well, it's now somewhere on the horizon. Somewhere, we had a political change. All of the funding, was cut severely. And my son's now going to be 20 in February, and he's aged out of any kind of trials for cerebral palsy for children. And so he will not be cured.
So this is where we bring you back in. So again, and I just keep thinking of my mom and how being my caregiver affected everything. It affected her career. It definitely affected my parents' marriage. My mom started drinking. She couldn't handle the stress. My dad sort of vanished. I don't know how personal you want to get with things. So how do you, family dynamic must be like a minefield for you to deal with when a kid shows up that's going to be so much more work than a couple had thought.
Absolutely. And I know for a fact I read a research article not too long ago, and I'm not sure how it generalizes to other situations, but in families where there is a child who has autism and is at the lower functioning level, 50% of those marriages end. And it's basically attributed to the dynamics in the family that occur out of having to care for a child with special needs. And I don't think I mentioned this earlier, but another thing I do at the regional center is run a sibling support group. Because oftentimes when there is a child with special needs, other siblings may feel neglected, right? Because all of the focus and attention, oftentimes, rightly so, has to go to the child with special needs. Or sometimes children have told me they're embarrassed. You know, my brother or sister does this or that in front of my friends or in public, and I'm really embarrassed. Or they get tired of having to watch them, tired of the responsibilities that come along. So again, that's why a lot of my work is never focused just on the identified patient, but has to include the entire family system, and even trying to bring in the community as well. So something that we're doing now is trying to educate the community, right? Special education teachers, but what about the women who work in the lunchroom or other people at a school setting, that they have a more comprehensive understanding, I think, as more of these children are integrated into typical settings, right? That they have more of an understanding of what these families are experiencing.
So we were talking before about like the change in politics. So to both you guys, you can talk about things that affect patient care. And again, if we can bring it back to them with their future students, with their future patients. But like, not the previous administration, the one before that, cutting stem cell care, votes matter, things change, and sometimes you don't expect them. You thought stem cell was going to cure your son, and then all of a sudden, somebody's like, oh, we can't do that anymore because political reasons. So what things have popped up in both you as an advisor and you as a parent that you just completely didn't expect, that as a caregiver sort of changed the direction or something?
Do you want to go first?
Oh, no, go ahead.
No, I'm thinking.
Oh, okay. Okay, well, while you're thinking then, a couple of thoughts when you talked about the surprising piece, a couple of thoughts popped into my head. And the first one, again, as I said, I work with primarily communities of color, and it's been actually quite disheartening to me sometimes to see the treatment that they receive, right? Seeing service providers saying, your son or your daughter doesn't qualify for something, when that's absolutely not the truth, right? And that's why, again, I now rely so much on advocates lots of times to assist these families when they're having to make important decisions. So that was one thing that surprised me. I think, too, when I interact a lot with educational providers, sometimes there's a burnout or kind of a sense of apathy that's almost developed in a way. And so that's another important area to address as well. So yeah, I think those are a couple of things I've seen lately.
So when people are being told they're denied, is it because of lack of information on the bureaucratic side, or just people are like, oh, here's somebody wanting something for nothing? Like, what's the dynamic when these parents are coming with help for their kids?
So with the parents that I work with, I think what a lot of it is that a school, for example, so a lot of the parents I work with have been told, our district doesn't provide one-on-one aids, right? But of course they can provide a one-on-one aid. They just don't want to do it for whatever reason, right? And again, lots of times the population that I'm working with, if somebody at school or a doctor, you're seen very much as an authority figure, right? And in a lot of cultures, they wouldn't dream of questioning a doctor or a principal or a teacher, right? And so that's the unfortunate part. So I think it's just the extra work it would entail, the cost it would entail, but still, right, the children have the right to the support services they need to be successful. And I have to oftentimes help my patients advocate for those and teach them how to advocate. Because again, sometimes it runs counter to their cultural or other beliefs that they may have.
Any thought? If not,
Yes,
we'll move on.
no, I do. I did not know that I would have so much headbutting. The most difficult part of taking care of my son is not taking care of my son. It's the administrative part. It's navigating the system, hands down. When someone tells you something, if I could just tell you this one thing, to please never, ever, ever tell a parent, ever. My son, newborn, in a coma, and he's ventilated. Okay, and I say to the doctor, this doctor had a terrible bedside manner, and I say to the doctor, "What can we do?" What do you think he told me? It's exactly what he said. He said nothing. Nothing. Okay, first of all, I didn't know at the time. I already had a very hard time with this doctor from the get-go. Parents have a right to dismiss a doctor or a caretaker. I didn't know that. I didn't know anything. Never tell a parent no, nothing. You tell that parent, you hold that child, or a partner or a spouse. We don't know if he can hear us. Talk to him, because they might be able to hear us. We don't know, what his sensory sensitivities are going to be once he comes out of this. Touch him, read to him, sing to her, okay? Never tell a parent there is nothing you can do. A baby dies. You go to the parent and you say, "We can make a cask of your baby's hand. Would you like to help us do that?" You always give the parent something that they can do, because if you don't, they will feel helpless and worthless.
Agree.
Yes, absolutely. Yeah, absolutely.
All right, we're going from that very serious thing to some of your other work that's not in the gallery.
Yeah.
So why don't you, it's bright and colorful, so it will.
I've been doing a lot of sculptural pieces, and your gallery is mainly for two-dimensional art. So these are pieces that it shows you some of the parts, how they move into the studio. Castings, I did castings for the 60cc syringes that are really long, and it's funny, people could walk through this piece that's in the center and move around it. I also am very conscientious of wheelchairs, so I make sure that everything I design allows for a wheelchair to be able to turn 360 degrees. That's one of my criteria. The trach masks, I just think there's kind of a little bit of humor in there. The piece on the right looks like a skewer, like you're gonna have a barbecue. So I like to play with a little funniness too, to get somebody to not be so afraid. I don't make art out of the materials for the materials to then be an illusion to make you think you saw something else. Like, there'll be artists who will make things out of, little caps and needles and all that, and you say, "Oh, look, it's a face," and then you get up close and you see something else. I don't do that. I don't want to trick you into seeing something that's not there. I want to be true to these materials because I think they're absolutely beautiful the way they are and for the function that they have, but I also want to play with them in a way that instead of being tricked, the average person will say, "What is that?" And that's how I trap them to come in and closer and explore.
So do you find that once they realize what's really going on, do they take a step back, or does it pull them in?
Both. The 60cc syringes, I can't tell you how many people said, "Oh, I didn't know they had syringes that big." That was fun. And they're really trying to imagine like injecting somebody with a syringe that big. It's so funny. And then there are other people. I had a just tender, beautiful little mobile hanging. It looked like a phylogenetic tree, you know, and the vials were all filled with all of his baby teeth, which I still have because they have stem cells in them. But you know, it was casting these beautiful shadows in the gallery, and somebody came by and said, "Oh, it's a mobile," and backed up, went into the gallery, got close, and said, "Ew, it's teeth." So, yeah.
All right, so I think it's the last. So this is your studio, and this is your supply. So I was sort of amazed when we talked today, just the logistics of you keeping the supplies in your house. So why don't you, because this is something I would have never thought about, you know, the volume of things and how you deal with making sure you've got what you need to take care of your son.
Yeah, parents don't always get what they need. My son had a really difficult time with digestion, and so we couldn't get food for him. And I said, he's gonna die. We have to have food. What are we gonna do? And the formula was thousands of dollars, the one that he could tolerate and break down. And our insurance wouldn't pay for it. What do you do? So over the years, we did figure it out. We found a foundation that helped and paid for it, and he was okay. But you are, for the whole entire time that you're caring for this individual, you will be fighting the system. You will be fighting insurance. You will be, you know, prescriptions run out. The medication's not on the formulary list. It is a full-time job just doing that. And so there are many times where something will stop and it will not come. Those supplies are not going to come for one reason or another. The insurance has changed it. They're not going to cover that any longer. So my basic rule with everything that I can do is to have a 2 or 3 month supply ahead of time. And the only way you do that is by hoarding a little bit, right? In the beginning, you're like, oh, good, we've got so many of these left over. And everything's marked and everything's sorted, and that's my garage of his supplies on the left. On the right is my studio with those are after they've been used with Julius, washed and sterilized, and then brought into the studio, and then it just becomes a disaster. One thing I love about these supplies is that because they're you know, I used to work huge. I used to do huge murals. Well, now everything has to be made in these little pieces like puzzles. And so I'll sit there and you know, the kids are sleeping. It's late at night. My studio's attached to the house. And I'll have music on, or I'll listen to, you know, podcasts. And I'll just sit there and, you know, do these tasks, whatever they are. And not all even know, I don't always know where it's going. I had no idea that those syringes were going to turn into that type of installation. But then eventually you start seeing it and you say, oh, I know what I need to do. Oh, and I have a staging table and I start piecing things together, and then it grows and grows and grows. And that's how the installations happen. They're little parts that end up growing together to make a large piece.
Okay, I have one last question. If anybody else has a question, you can go to the microphones. So looking at this, and you can jump in on this too, if you were not, I don't know your economic level, but like if you didn't have a garage to store this, you couldn't be doing this. So, I mean, just the idea of having the economic well-being to have a garage and not a one-bedroom place allows you. I don't even know what my question is here, but
I know where you're going. But when I was in undergrad school, I had this one bedroom, this little studio, and it had this tiny little room off of it where you could put a bed. And I slept on the floor because I wanted to have my drafting table there. So it's all priority, right? Whatever space you have, if that thing's important to you, you'll sleep in a sleeping bag on the floor, which is what I did because my art was more important than me having a bed.
But I'm talking about the care, not so much the art, but just having the supplies there to keep this system going of hoarding the supplies. You need somewhere to put them, and not everybody would have the economic well-being to have a room just to keep that, and they'd be much more dependent on the calling up every month to get new pills and things. So, you know, there's all different levels. I'll let you make one last comment on that, and then if anybody has a question.
Yeah, it's true. So several of the families I work with actually rent a bedroom in a home. So there's 4 or 5 families living in one house, right? And each family has a bedroom. They all share the bathroom. They take their toilet paper back and forth to the bathroom every time they go. They don't really know each other, but these are families that cannot afford $1,500 a month for rent, right? So they rent out these homes and they each pay $300 or $400 a month to live in a bedroom. So I have sometimes families of 5 or 6 that are living in one bedroom in a home. And so, yes, it makes it difficult. I also have a lot of families that live in neighborhoods where there's a lot of gang activity going on. And so, yeah, those things definitely can make it a bit more challenging in terms of the family and what different kinds of activities they can provide for their children. But then that's just when we'll do a lot of brainstorming and, you know, try to figure out how we make sure they can get their needs met for themselves and their children. So maybe it's finding a local park or something like that where they can go and enjoy some time and hopefully have some type of an outlet for their creativity.
Also, parents will go to the hospital. They'll go to the ER. Like, I know families that, you know, if you're in a situation where you don't have that supply, and you can't get that supply, and I've actually had to do that with the feeding button, you go to the hospital. That's it. That's all you can do.
Hi, that was an amazing talk. Thank you so much for all the information. I co-chair the Social Work and the Arts Student Caucus at USC, and thinking about all of these ideas in perspective, it seems that you will in both of your situations, have processed your difficult situations very healthfully, and whether you believe that about yourself or the way you feel about yourself aside, outwardly, it seems that you are able to deal with these issues very well through art and through other outlets and people and support systems. However, I feel like the majority of people do not process these events well and need so much help understanding themselves, their lives, and the things that surround them. And I would love to hear both of your opinions on how, even just your own personal thoughts on how those people might be able to be reached, because art is an amazing outlet for these things, and if you have it, it's beautiful. And like you stated about your son, some people don't flow with that, and that's 100% fine, but how do we reach, I want to reach everyone. How do we get a little closer to that? And I would love to hear both of your responses to that. Sorry.
You want to start?
Well, I actually, so in my practice as a psychologist, I use a lot of art therapy activities, right? Because I work with children as young as 3, up to older adults, but I work primarily with a lot of children. A lot of them are trauma survivors. A lot of them are also children with special needs. And I think for younger children, art is often their language, right? Play and art is often their language. So I'm not going to sit down and have a conversation with a 4-year-old about how they feel about their trauma, right? But what comes out in their drawings, in their writings, in the play activities is really amazing. But one other thing I wanted to add is I also oftentimes have to educate the parent, right? Because they're like, and I also do in-home therapy, so I go to my clients' homes. And they're like, you're going to sit here and draw and play with them for an hour, right? They think, is this legitimate? Is this really like therapy? Is this really helpful? So having to educate the parents oftentimes about how art and play therapy can really be meaningful ways to engage their child and help them process their trauma or whatever it is they're dealing with. So again, as we've been talking about, having to bring the parents in and make sure they have an understanding of that.
One thing that happens is you get a lot of caretakers, especially in the very beginning, coming to your house, a lot. And they're all giving you, oh, you got to do this, and you got to do this, and you got to do this. And at the end of the day, you feel like you're going to cry yourself to sleep because there is no way you got to all the things that they said you have to do, right? And so what I found was that, and I learned this through feeling like a failure. What am I going to do with my kid? Best thing I learned, integrate everything, whatever it is. So when I take him to the park, and I didn't, I think, I didn't have time to sit there and do his range of motion today. Well, what if range of motion was part of something that you had to do anyway? You have to take the dog to the park. So you have a stick, and then you throw the ball, you hold his hand, and you help him throw the dog, for the dog, the stick, and he's getting that rotation that he was supposed to sit there and get for an hour at home, right? Go to the grocery store, sensory, okay, oral aversion. Oh, look, oranges today are on sale, whatever. Put it up, roll it across their mouth and their faces, okay? So again, art is not just making a thing. It's how you see the world. It's how you interact with everything around you, shape, color, sound. So think of art bigger, and you will bring it into everybody's life in some way or another. And so integrate the things that they need to have to be able to develop, and access the world as best that they can. Within the world, use what's already here.
Thank you both so much.
I think we're at time, but I want to thank you both so much, and thank you, Ted, for facilitating. I want to say that as a pediatrician, this conversation has helped me tremendously. It's reminded me of several things, and I think for our students and any practitioners here with us today, we all know about the system also. It's our frustration as well on behalf of our patients, and I feel like I've learned even more what kind of impact that is for families, but also some of the tools and resources that I, feel more empowered to use now. So for instance, I love Regional Center. They're the very best resource for my patients with needs. But I also am thinking now how much more aggressive I'm going to be when those families say to me, I can't get an aid for my child in the classroom. I always offer to speak with the teachers, with the administration. I think I'm now going to insist on it. So thank you for helping to teach me. Thank you for sharing your story and your art. It's beautiful, and I think really helps us all appreciate what our families go through. Just another mention is that many of our shows, as you know, almost all of them are about a particular illness or condition that aligns with an organ system that our students are studying. Once or twice, this I think is our second show, transcends all of the organ systems and is something that all of our patients, all of us, no matter what specialty we have, we will have families and patients who we need to take care of in this way and to help. So thank you. Thank you, Ted.
Thank you.